Would you mind to like and subscribe to keep it free for others? You too can send your results.
The question.
Many questions sent to me like, when I go to remove my prostate gland, which PSA test level urge for removing prostate cancer by surgery? At what PSA level requires surgery prostatectomy? Which elevated PSA must do prostatectomy? Can PSA extreme levels tell that prostate has a cancer and must be removed?
Professional explanations. For ordinary people.
Results interpretation.
At first, we must re-identify borders and limits. PSA normal range 0 to 4 in general. Prostate size is normal up to 30 in average. Alarming prostate gland volume is 60 to 80 gram. Dangerous size is above 80. PSA stands for prostate-specific antigen, is a blood test used for just screen, not for direct diagnosis of prostate cancer. That's because PSA levels can vary from person to person and can be altered by many factors, as we mentioned them in the last videos. You can watch them in the PSA playlist. Prostatectomy is process used by the surgeon doctor to remove some or the whole of prostate gland. Factors to decide prostatectomy are not severity of symptoms as obstruction of urine to very big prostate size, usually above 60 grams, whether repeated obstruction or continued for long time. 2. Very extreme PSA reading, usually greater than 100 and increasing rapidly. 3. If PSA level is within normal limits, 0 to 4, or elevated but free PSA ratio is below 16%, which is alarming marker for prostate cancer. 4. Familial history of prostate cancer is a crucial factor for prostatectomy. 5. Progression of prostate cancer to other organs and other areas of the body. Its malignancy, particularly if chemotherapy is not going to work. For very large prostates, a simple prostatectomy may be performed, where part of the prostate is removed through an abdominal incision and called prostatectomy. There are various surgical options available, such as transurethral resection of the prostate, TURP, which involves trimming excess prostate tissue through the urethra using a resectoscope. Also, there are minimally invasive options such as laser therapy, which uses lasers to remove or shrink prostate tissue, and urolift, which lifts and holds the enlarged prostate tissue out of the way, are less invasive options. Traditionally, suprapubic or retropubic open prostatectomy is practiced on patients with prostate volumes larger than 80 to 100 grams, according to the American Urology Association, AUA, guidelines, although open prostatectomy is more effective than TURP in alleviating symptoms, and particularly in cases of bladder issues. The urolift procedure is a minimally invasive treatment for men with an enlarged prostate due to benign prostatic hyperplasia, BPH. Generally required to being a candidate for urolift, you should be a 45 years man or older which suffering from frequent urination, a slow urine stream, discomfort or pain in the bladder or penis, and frequent urinary tract infections, UTIs. Also, while there isn't a strict prostate enlargement size requirement, the procedure is typically suitable for men with prostate sizes that cause urinary obstruction. Techniques like transabdominal ultrasound, TAUS, and MRI are commonly used to measure prostate volume accurately before surgery, which is crucial for planning surgery, the prostatectomy, particularly radical prostatectomy. While the size alone is not the only factor considered when deciding on surgery, the cancer and APOS, S aggressiveness, patient and APOS, S overall health, and other factors also play a role. However, men with small prostate size may experience more unfavorable prostate issues after removal and vice versa.
Bloodtestsresults.com. Happy to help. bloodtestsresults.com. Happy to help.